Welcome back to a new episode of Skin to It, your guide to healthy skin.
I'm Marlo Sutton, fashion stylist and beauty enthusiast.
And I'm Dr. Sandy Skotnicki, your trusted dermatologist.
Today we're diving into an exciting topic.
We'll break down everything you need to know with Dr. Whitney Bowe about the science of skin, skin cycling, science-backed skincare, and the gut-skin connection to help you care for your skin like a pro.
So grab your notepads and let's get skin to it.
Welcome back, and today we are joined by an incredible guest, and I consider a friend, Whitney Bowe, to discuss skin cycling, science-backed skincare, and the gut-skin connection. All passions of Whitney's, and thank you for being here, and I can't wait to talk about all of them.
It's such an honor and a privilege. I feel like it's been too long. I wish we were in person and I could hug you again, but and it's so great to finally meet Marlo, but thank you guys so much for having me.
So I'm just going to give you a little bio. It's very impressive, so hang in there, listeners. Dr. Whitney Bowe is a leading dermatologist, research scientist, and creator of the viral skin cycling trend, which has influenced over 3.5 billion people worldwide. She frequently appears on Good Morning America, the New York Times, the Wall Street Journal, and Vogue, sharing her expertise in integrative dermatology and evidence-based skincare. A Yale graduate and University of Pennsylvania School of Medicine scholar, Dr. Bowe has published over 40 scientific articles, served as medical director at Advanced Dermatology, and is a clinical assistant professor of dermatology at Mount Sinai in New York. She has been recognized as a Castle Connolly top doctor and exceptional woman in medicine since 2017.
And to continue, in 2020, she published her book, Dirty Looks, The Secret to Beautiful Skin, where she explores the hidden factors that accelerate skin aging and how a holistic, science-backed approach, including skincare, gut health, and lifestyle changes, can reverse signs of aging and improve overall skin health. As the founder and CEO of Dr. Whitney Bowe Beauty, she applies her scientific expertise to create innovative skincare products. Trusted by celebrities, models, and TV personalities, she's known for her #ThatBoweGlow approach to radiant skin. With over 1.3 million social media followers, Dr. Bowe is passionate about educating and simplifying skincare for all.
So thank you so much again for being with us.
Thank you. Thank you. So before we get into all of the science, we'd like to start off and ask our guests to talk about their journey. So how did you get to where you are right now as a dermatologist, an author, media personality, now a skincare developer? I'd love to hear your journey.
Yeah, no, I mean, I do wear many hats. I think probably a lot of it started, I was 10 years old. I went to the Bahamas with my family, and I had conch chowder, which is a type of shellfish. It's just like a bowl of soup with some chowder in it. And I got violently ill. I came back to the States and I was hospitalized, and the doctors thought that it was bacteria, a bacterial infection. It turns out it was a parasite that I had, but I was treated with broad spectrum antibiotic after broad spectrum antibiotic, which basically decimated my microbiome of my gut. And so I ended up with a rip-roaring case of C. diff colitis. I got really, really sick, and I was just in and out of the hospital fighting for my life that entire year. And I remember a resident at the time, when we are in training, we go through our internship, our residency. So a young doctor was sitting by my bed, and she was trying to explain to my 10-year-old self what was going on and why I was in so much pain. And she said, Whitney, there's this battle, this constant battle in our bodies between good and bad bugs, little microbes, right? We can't see them. And we accidentally, wiped out the good bugs, trying to help you. And so unfortunately right now, we have to bring that balance back. And that's why, you're experiencing the pain that you're experiencing, but we're going to get there. It's going to take time, but, hang in there. And I just remember, emerging from that experience. Thankfully, I was able to regain my health. It took quite some time. It was not a quick process. But I really emerged with this profound respect for the impact that the gut can have on our overall health, the impact of, the microbiome, like understanding these microscopic organisms that are in our guts, on our skin, the profound role that they play in our health and well-being and our immune system and our ability to feel well. And, and it really impacted me. And I wanted to not only, really commit my career, my life, my passion to, finding health, helping others really reclaim their health, but optimizing health. I became almost obsessed in a way with how do we really optimize our health so that we're able to function at our top capacity and feel our best. And that's one of the things that I think about when it comes to the skin is truly a window into our overall health. And, it how you feel, it's all reflected in your skin, so people come to me in the office. My practice has been capped for close to 8 years now. I haven't been able to accept any new patients during that time. But, when people come for procedures and, they're seeking me to do the use most cutting edge technology, injection techniques, PRP, microneedling, Fraxel, laser resurfacing fillers. I always say to them, like, it starts with what you're doing at home. Like, let's start there, because I don't want you to spend a penny with me until we talk about your sleep habits and, what you're eating for breakfast, your lifestyle, how are you managing your stress. And sometimes that takes people, by surprise. But really that is the most long-term way to affect your skin health. And then, of course, there are things that I can do in the office to expedite things and make things a little more dramatic for the red carpet for my celebrity guests, et cetera. But, it's really about taking that integrative, holistic approach that is always first line for me.
Well, that's great. I
Wow.
think I remember now, because we haven't, we kind of, talk to each other a little bit on Instagram sometimes, but Whitney and I met at a meeting in Boston back in 2018, I think, or 19.
It was pre-COVID.
Yeah, it was
pre-COVID.
right before COVID.
Yeah.
And I think I recall you telling me about this story. So, wow, that's pretty impactful. Well, one of the topics, obviously, we wanted to have you on was because of your book, and we'll get to that. But Marlo's a big TikToker. Okay, I'm sorry, but you are more than me. But
I'm on it. I'm
and she's
looking.
like, my God, she's got 1 million followers on TikTok. So we really want to talk about. I think we were sort of chatting briefly before we went on about sort of how you've gone crazy on TikTok, and some of it's got to do with this. We're going to start off talking about skin cycling. So would you agree that's kind of like you've done so many things, but this is where you really. This was a viral skincare sensation. Let's talk about skin cycling for our listeners who aren't familiar with it. Why is it so effective? How did you come up with it, and the crazy ride since then?
Yeah, no, absolutely. So skin cycling is my deliberate strategic method of just cycling through your powerful skincare actives, like your exfoliating acids, your retinoids, right? And cycling through those in order to maximize results in the skin, but minimize irritation. So it really takes this smarter, not more approach to skincare. So on certain nights, you're pushing skin outside its comfort zone using these powerful actives. But then on other nights, you're building in what I call recovery nights, which I think Dr. Sandy would really speak to you, because it really, on the recovery nights, you're really thinking about maintaining and repairing the skin barrier, rebalancing the skin microbiome, and especially for people who are either have sensitive skin, mature skin, going through perimenopause, people who have experimented with too many skincare products or taken a kitchen sink approach to skincare. When you start cycling in this very deliberate way, the skin responds so beautifully because you're able to push the skin outside its comfort zone on some nights, and then also build in that barrier first approach where you're really respecting the skin barrier. So you don't end up with that irritation, that we often see with our patients who just sort of do the same thing every day. It's very intuitive. Like, you wouldn't, your mind needs recovery, right? Your muscles need recovery. Like, you wouldn't go to the gym and do the same exact routine. Like, say that you were doing like a strength training routine with heavy weights, with squats and presses, right?
Yeah.
You wouldn't go back and do that the next day and do that the next day.
It's actually a great
If you're
analogy.
training for the Olympics, you wouldn't do that either, right? Like, trainers are thinking about like cycling through, like maybe some days they're doing cardio, some days you're doing, Pilates or yoga and you're
Right.
thinking about lengthening the muscles. Some days, if you do a hard workout, you need to build in time for those muscle fibers to recover so that they can be stronger rather than create stress issues and fractures if you sort of overdo something. The skin is very similar. In the office with my patients, I'll often do laser treatments or microneedling treatments, and we cycle through as well. Like if somebody says to me, "Oh, I want another Fraxel laser," and I look at their schedule and they just had one 2 weeks ago, I say to them like, "Wait, we need your skin to fully recover before we can, hit it again with that, deliberate stress," right? So it's very similar in terms of what you can do at night. And when I started doing that with my patients in the office and I started cycling them and customizing
Right.
their skin cycling program because there's not one size fits all. The one that went mega viral was this 4-night cycle: exfoliation night, retinoid night, recovery night, repeat back to exfoliation night. That one went mega viral. But with social media, you sometimes lose these nuances because I had hundreds of other videos talking about how to customize it, right? If you have really sensitive skin, rosacea, eczema, skin sensitivities, you may want to just build in extra recovery nights.
Right.
If you have oily, acne-prone skin, or you're accustomed to powerful actives, you've been using retinoids your whole life, you can then flex up to an advanced skin cycling program and do back-to-back retinoid nights. So it's really about listening to your skin and being intuitive about your skin, but having that basic framework where people think about, okay, wait, so I exfoliate first, which is going to dissolve away that uppermost layer of dead skin cells, prep my skin to get ready and get the most out of retinoid night, which is night 2. And then you sort of cycle into these recovery nights and then cycle back. Like just that understanding that basic framework before you try to flex up or flex down was this like aha moment for billions of people.
Right. Yeah. I mean, it's obvious why it went viral because people definitely like just the way you described it. They like to have a structure and to be told what to do because then they actually do it. Because if they're just like not sure every night, either they won't do anything or they won't do the right thing. But when they have a structure, they'll actually follow it. It's like a plan to get them to their goal.
It's an actionable plan. And it doesn't contradict the advice that dermatologists have been giving. Like we've been giving that advice forever. There was nothing completely novel, but we delivered it differently. Like we said things like, you only want to exfoliate a few nights a week. You don't want to over exfoliate, right? Yeah. And we would say things like, you want to use a retinoid, but don't do it on the same night as you exfoliate if you have sensitive skin. Like we gave that advice, but we never gave it in a way that was so easily implemented, right?
And actionable, as you said, actionable.
Yes,
Yeah.
yes.
So, and just on a personal level to ask, I really don't have sensitive skin, luckily.
Yeah, she has none.
No, I never react really to anything, luckily.
And I'm the opposite. Right.
Yeah.
I'm with you, Dr. Sandy.
Yeah.
Yeah. So, and I'm post-menopause now. So for someone like me, what would your recommendation be?
Yeah, I mean, if you are thriving using a retinoid every night, if you're somebody who you can tolerate tretinoin, like a prescription strength retinoid every single night, then I don't think that skin cycling is going to do that much for you. I mean, I've had the occasional patient who've been using retinoids every night who realized that if they actually took a break every third or fourth night and introduced a leave-on exfoliating serum, that they actually did get a little bit more out of their overall skincare routine. Like some people do find that it's a way to level up. But skin cycling is not really meant for the person whose skin is thriving using a powerful prescription strength retinoid every night. Like that's not the immediate person that I think of when I think about you're the perfect person who, would really do well with skin cycling. I feel like skin cycling works beautifully for people who are either new to powerful actives, or they have sensitive skin, or they are interested, they're not reaching their goals. Like I have some patients who are on a retinoid every night and they say to me that their pores still don't look great and they still feel like the texture's not, and they actually do better when they start to shift up their program a little bit and do an advanced skin cycling program. But if your skin is already thriving, I mean, from this bird's eye view, looking through the screen at your skin looks amazing. Like if you feel like your skin is thriving and doing great, and you're able to tolerate, that retinoid every night, I wouldn't mess with a good thing.
Right.
So I have two comments, and I've just learned something. I kind of knew it again intuitively. What you said when we were talking, when Marlo and I were just running through the script before, as derms, we've been telling people to use your prescription tretinoin just twice a week. But you're right, it's how we deliver it. So two things. One thing you maybe glossed over that I just want to reiterate for our listeners. When you're talking about upcycling, so when you use a retinol or retinoid or tretinoic acid, which is prescription, you said, and I kind of knew this intuitively again, but if the night before you use a bit of a peel, a glycolic peel, you actually can increase the delivery the next night of your retinoid. I don't know if you caught that. Did you catch that?
I totally did.
You did catch that.
Yes.
Okay. So
and it's amazing advice.
It's a way of upcycling it. Yeah. And they both, retinol and retinoids and glycolic acids, do similar things, but they are different in that you're going to get more anti-aging benefit from the tretinoin and the retinol. The second thing is, I was listening or reading something of yours about skin barrier. Now, we did a tween session about, young kids, tweens using all these anti-aging things, actually hurting their skin, like hurting their skin barrier, and actually maybe even causing more aging because they're letting more pollution and UV exposure in. So I think that even if you're like someone like you who doesn't have any issue, I think throwing in a recovery day and sort of repairing that barrier, even if you're not having any issues, is not a bad thing. Would you agree?
I mean, you and I agree completely on the fact that I think more and more evidence comes to light that the skin barrier health and skin barrier resilience is so important for everything, whether it's aging. And what you just mentioned is like a lot of people don't even realize that there's a sort of chronic low-grade level of inflammation occurring in their skin if they're constantly sort of stressing out their skin barrier, pushing it a little harder, even if they don't realize it, even if they're not cognizant of it, maybe they don't experience symptoms. Yeah. Maybe their skin isn't red, blotchy, irritated, sensitive, right? Maybe it's not so overt, but there may be this sort of low grade level of compromise to their skin barrier. And we know that if that's ongoing, then the skin is always just slightly inflamed. Right. And if that's true, then it's always going to be on the defensive. It can't play offensive. Like if your skin is constantly putting out fires, then it's not able to go into that deep restorative, reparative place where all of a sudden those fibroblasts are like, hey, I'm going to really, start pumping out, the collagen and elastin and hyaluronic acid. And, I think there's something to be said for erring on the side of really supporting that healthy skin barrier. And we know that a healthy skin barrier plays a role in even acne, rosacea, eczema, psoriasis. Like the more that we're learning about the skin barrier, the more important it is. I also love the fact, the reason why skin cycling, I think, worked for so many people, compared to what they were doing previously is because the order does matter. Exfoliating the night before you use the retinoid makes a huge difference because it does allow for that enhanced penetration. But what some people were doing is they were trying to layer all the products on the same nights.
Right. Yeah,
and they work through a different mechanism of action. Like alpha hydroxy acids and retinoids both speed skin cell turnover. They can both stimulate collagen synthesis over time. They can both help with hyperpigmentation. There's a lot of overlap in terms of what they ultimately deliver, but the way that they do that, the mechanism of action is totally different. And when you layer one on top of the other, you don't get that synergistic benefit. Right. You end up just getting more irritation. So it was sort of that chronological order of doing one before the other that for a lot of people, all of a sudden their skin really responded well to that. Yeah, and I think
it's a bit of an aha, and then you see the results. So the last question before we leave skin cycling is, you kind of touched on it a little bit, but do you have any, things that you're going to add or change within, like, do you have new programs or anything? Like, so I want to bring up something. Sandwiching is not necessarily skin cycling, but, I have some people I talk about, as you said, a lot of dermatologists intuitively tell people to cycle, but don't use the same language. But they'll be like, well, if I put on my moisturizer first, and then I put on my, my acne medicine with a tretinoin or if you're using it for anti-aging. And then I put moisturizer again, I'm sandwiching. Why do you think that that's not as, I know my answer, I want to hear yours, not as effective as skin cycling?
So I think that like the sandwich technique that you described, I actually think is really helpful for people. But doing that every single night may not be the answer for
Right.
people. So, if I often do recommend the sandwich technique when I'm trying to ramp up the strength of a retinoid. For example, if somebody's going from retinol to retinal with an AL, or they're going from retinal to tretinoin, or they're going from a lower percentage tretinoin to a higher percentage tretinoin, there is that added benefit of sandwiching can slightly dilute, the penetration of that active and almost like allow your skin a chance to adjust to that powerful active or that new strength of the product.
Do you think it is also, like it's improving the skin barrier to a certain extent, which is why it's less penetration, but also that's maybe why it's less irritating?
Absolutely.
Yeah.
Absolutely.
Yeah.
Yeah. I do think that sandwich technique is actually an excellent technique, especially using a prescription strength products, because you can't control the base, the vehicle, whereas, for example, when I was formulating my retinal night, I created a biomimetic base. Like I created a pentalipid matrix where I actually looked at the skin barrier and said, how can I mimic this using vegan, sustainably sourced ingredients? Like looking at things like phytosphingosine and cholesterol derivatives and thinking, how can I recreate this as the base? So, I was able to create that base, which feels very velvety, and then embed the retinol in that.
Right.
But as a doctor, when you prescribe something, you don't know necessarily what the generic, exactly what that. So if you control the base by doing something like, say, sandwich technique, and you're saying, okay, I'm almost like creating the base, and then I'm introducing the active, like it gives you better control over that patient experience.
And I saw on your TikTok how you said, like you just explained, if you're going something, let's say in a higher concentration, maybe you've gotten used to that at the lower concentration. And when you just first introduce the higher concentration, to use the sandwich technique until you kind of, your skin adjusts a little bit and you can maybe start using it on its own.
Yeah.
Exactly.
What's interesting, as dermatologists, I mean, I've been 28 years. I'm not sure how long you are. We always used to say, put medicine on first, moisturizer after. And then when all the skin barrier kind of information came up, like how important it is, and then they actually did studies showing, like, well, there's a skin barrier defect even in acne and even rosacea. So if you repair that, you actually tolerate the actives better. Okay, but we have so much to talk about. I think I want to move on to science-backed skincare, and it's kind of a great segue because you were just talking about, all the scientific people that are involved in the production of your skincare. So let's talk about science-backed skincare. It seems to be everywhere. A lot of it's not. And as a dermatologist and research scientist, how do you define it, and why is this so important in skincare?
So I think there's so many quote unquote science-backed brands, right? And they sort of present it looks so clinical and so scientific, right? But I think if you actually sort of peel it back and say, like, what's going on underneath there?
Where's the science?
Where's the science?
Yeah.
The first thing that I think most brands do is what's called relying on ingredient supplier data. So what they'll do is they'll make a claim based on individual ingredients. So for example, you'll see a claim like repairs the skin barrier, and you'll see an asterisk, and you follow the asterisk and you see this fine print. And it's like, because it contains ceramides, which have been shown to repair the skin barrier.
Right.
So, I think that's sort of the easiest, least expensive way to do it, is to formulate with ingredients that have strong science behind the ingredients. But, ingredients are not the same thing as the final formulation.
Right.
So a great analogy is like you take 2 eggs, right? And I explained this to my daughter the other day. I was like, if you take the 2 eggs and you make it into a cake, you add refined flour and refined sugar, and you add, whole milk, and then you have a slice of that cake for breakfast. It's very different from making an avocado toast and taking 2 hard-boiled eggs and slicing them on top of the avocado toast. They both contain the same ingredient, the same active ingredient, right? They both contain the 2 eggs, but the end result is very different. And that's the same thing with skincare. The final formulation is very different, from just sort of making a claim that both formulations can contain one great ingredient and they can do completely different things for the skin. One can destroy your skin barrier and the other one can be incredible for your skin health and your skin barrier, right? So, the next level up from ingredient supplier data is to look at what's called subjective data, subjective analyses, where you basically, it's almost like a survey. So you're giving a certain number of subjects the product to use over a certain period of time, and then you ask them a question. And from that kind of a study, you can report things like 97% of subjects saw an improvement in fine lines and wrinkles, right? That's a survey. It's important data. I'm not saying I'm going to collect that data. I think it's important to hear the point of view of the user. But as a scientist, as a trained research scientist, like that would never get published in a journal. You can't right? So you actually have to measure it.
Someone's just saying, "Oh yeah, I look better."
Yeah.
So I like to use instruments, right? Like corneometer, tuometer, next generation sequencing technology. Like if we're going to make a claim, I like to measure it, see the statistically significant, like actually objectively measure that in a third party clinical testing center that's completely unbiased. And then ideally, the gold standard is publishing it, right, in a peer-reviewed journal. And we've now had 3 publications based on our products that are all published in top derm journals that went through the peer review process, which in my mind is really the gold standard. But if you look at all these science-backed brands out there, like how many of them are going beyond that first step, beyond the ingredient supplier data? It's actually very few.
So, when consumers are out there and they're looking at different brands, do you have any advice? If somebody says clinically proven results, I guess I understand that could mean a lot of things.
It can mean little or a lot. Yeah.
Right.
We get a bunch of questions on social media and even through customer service, through the email on our website, where people say like, can you tell me more about the studies? Like, can you tell me more, about, was this tested on deeper skin tones? Was this tested on mature skin? Like I'm 74, was this tested on an older patient? How many people were in that study? Or, was like, we get those kinds of questions a lot. And maybe it's just because we're such a transparent brand and we're always, speaking very openly about the science. But I think a lot of customers and consumers want to understand now, especially like there is more of that conversation. People are more aware. They're more savvy. I think, you can't just, wear a white coat and hold up a product and say it's science backed. Like people want to sort of, you can, but I think I am giving the customers more credit than that. I think they are asking some really good questions.
Yeah, agreed.
So speaking of skincare, so we've already kind of alluded to it. I want to sort of dive a little bit into your skincare brand, Dr. Whitney Bowe Beauty. And you very graciously sent me your first 3 SKUs, which I've tried them all. They're all gone now. Otherwise, I would have them here. I probably should get some more. But you have so many more SKUs now. SKU, by the way, is a new product. You have a vitamin C. You have a retinol, which you said is a retinaldehyde. I think you said retinol.
Yes, retinol.
You have your sleep capsules, the elixir, the microbiome elixir. I want to talk about that. But one of the things I really like, and there is a question here, the eco-friendly packaging, the fact that you have the tubes that are reusable or refillable. But a couple things. We've already sort of talked. My question was, what sets your formulations apart? I think we already talked about the fact that you have done all these extra studies. Tell me what so for the listeners out there, peer review means you do a study. It's like some companies will do a study, but it's in-house. So like
it's called a white paper, right? Yeah. So like if you do the study in house, and maybe the protocol wasn't super rigorous, like it was like you kind of did your own thing in house, and you want to put it in a paper, you can do that, and you can print it, and you can have your rep bring it to an office and hand it to a dermatologist. It looks very scientific, but it's not going through the peer review process. A peer review process is the way that you conducted that study was with such integrity and done in such a rigorous manner that if you submit it to a peer review journal and then they take that manuscript and they send it out to your peers, meaning they send it out to other board certified dermatologists, they send it out to PhDs, research scientists, cosmetic chemists, people who understand science, who then look at it, through a very skeptical lens. And what they'll do is they'll make recommendations and say, I think this table or this figure needs to have more clarity, or they'll give you feedback. Sometimes they just flat out reject it, if the quality of the study isn't good enough. But if the quality meets certain criteria from your peers, eventually it can be accepted for a publication, and then it appears on something called PubMed. And PubMed is a database that a lot of scientists and dermatologists and medical doctors will use to look at evidence-based literature. So that's often how we do our research. Like if we see something on TikTok and, and they say, okay, can you, or somebody calls me and says, hey, Dr. Bowe, can you come on Good Morning America and talk about, this trend? Where do I go as my source to do my research? I go to PubMed.
Yeah, so those are called scholarly articles. But so going back to like in-house, so a big multinational, conglomerate that produces skincare could say, okay, we did, 30 people and this is what happened, and they can publish it. But no outside source is saying, well, that actually wasn't really a good study.
Right.
So, and that's where, going back to your question, Marlo, is, it says clinically proven, but was it actually, it might have been proven, but was it peer reviewed that the proof was actually true?
Right.
So clinically proven could be a subjective study. Remember that survey we talked about? That can let you say clinically proven. Dermatologist tested could be that I sent my skincare to Dr. Sandy.
Right.
Maybe I never heard back, but I said, can you test this? And I can say dermatologist tested. Like, it doesn't mean anything. You can make these claims and there's no like standard regulated, they're not FDA regulated claims. Like when you say broad spectrum on a sunscreen, that means something. It's an FDA regulated claim. But when you say dermatologist tested, science backed, clinically proven, like there's so many different ways that the brand themselves can define that. And that's what makes it so confusing for the consumer.
Well, that was a really great deep dive into, science-backed skincare. I hope the listeners really learned a lot there. Thank you,
I definitely
Whitney.
did.
So we're going to switch now to, we've got a lot of little micro mini topics, which I think is great because that also makes the podcast, like you might tune in for part of it or whichever you're interested in. So we're going to switch to lip care. So I think lips are often a neglected area of the skin. And so we really want to talk about lip aging, what happens with our lips as they age. So I'll pass it over to you, Whitney, to explain that for us.
Yeah, the lips are completely different from the rest of our skin, right? So the lips are much more vulnerable. They don't have that same protective barrier as the skin on our face does. And so it makes them especially vulnerable to dehydration and also to free radical damage and oxidative stress throughout the day, right? So we can experience accelerated aging both on the lips and around the lips. In the first, I would say like 8 years of my career, I actually traveled internationally training dermatologists and plastic surgeons on how to inject the lips and lip anatomy and lip histology and the ratios and proportions. And, bigger is not better when it comes to the lips, right? So just if somebody has two big sausages and the injector isn't respecting, the contours and the natural anatomy of the lip, we've all seen lip filler gone bad, right? So, I think the lips always fascinated me. I was always especially interested in the lips. But right now, we're going through this stage where, lips are really hot. Lip care is very hot.
Yeah.
But there's a lot of these plumpers and the traditional plumpers out there. The way that they work is they irritate the lips. They create deliberate irritation, which is followed by edema. And you get like swelling, right? Which is great for a quick TikTok or a quick Instagram because you put it on half the lip, you don't put it on the other half. Wow, look how big my lips get.
Right.
If you follow that person like 4 hours later, your lips are deflated, they're dehydrated, they're chapped because the way that it's working by irritating the lips.
Okay.
And so I said to my team, like, can we create a product that's going to restore the beautiful architecture to the lip, really enhance that Cupid's bow, increase the lip volume, but do so in a way that's actually good for the lips, the way that like a Dr. Sandy would recommend to her patients. And so that's really, what inspired Triliptide. I do so many lip flip procedures in my office, like either Botox or Dysport, inject it just tiny bits around the outside of the lip in order to flip that lip out a little bit, give it a little bit more volume, a little bit more definition. The Cupid's bow, guys, for those who are listening, if you take a lip pencil and you're outlining the border of the lip, it's that curve along the upper lip. And as we mature, that Cupid's bow actually starts to flatten.
Right.
And the upper and lower lips start to collapse upon one another, quite literally, right? Because the collagen bundles outlining the border of our lip, they reduce in volume, abundance, and they also lose their healthy structure. So, so when I formulated the triliptide, I wanted to basically restore that youthful architecture, but in a really, really healthy way. And we were able to do that. We tested this on, over 150 different subjects and did a series of different clinical studies. And one of them was to show that it could actually enhance the Cupid's bow up to 28% and increase lip volume up to 21%. No needle. So when we launched this, I was like, okay, there's so much science here. I don't know if the public is even going to grasp what I'm talking about. And it was explosive. We sold one triliptide every 30 seconds.
Wow.
It was our biggest launch yet. And it's been going viral all over social. Everybody's talking about, we're about to sell out, unfortunately, which is a good problem to have as a founder, but also incredibly stressful. So, we ordered a whole bunch more, but, I think there was a category that was needed, right? We needed something that was going to rejuvenate the lips, but in a way that wasn't going to actually destroy the lips in the process.
So we wanted to now switch over to finish this conversation and talk about the gut-skin connection. So this is one of the biggest areas of public interest in dermatology, is this connection. Can you explain how we eat affects our skin? And can you talk to us about the gut-skin axis?
Yeah, so the gut and the skin are intimately connected, and our gut health and gut lining, and whether our gut health is if our gut lining is intact and thriving and healthy, that can absolutely be reflected in our skin. And then, vice versa, if the gut lining is inflamed and not healthy, that absolutely also can take a toll on the skin. So, when you think about our gut, we have trillions of microscopic organisms, inside of our gut. And when we have something called dysbiosis, meaning that if there's an imbalance of the gut microbiome, it can actually lead to something called leaky gut. Is not a technical term. No, it's not in textbooks, but the concept is actually evidence-based in that our tight junctions actually don't function as well. And so the things that are inside of our gut that are supposed to remain housed within our gut, including inflammatory markers like, for example, LPS endotoxin. There are molecules that if your gut lining is compromised because you have this imbalance, this dysbiosis, this imbalance of the gut microbiome, you can end up having those those molecules penetrate through the gut lining, and they can actually then trigger system-wide inflammation, because about 70 to 80% of our immune system is actually lining our gut. It's called the GALT, the gut-associated lymphoid tissue. So if you think about the way that the gut is structured, we have all these microscopic organisms. Then we have this tiny, thin, delicate layer of cells. And then right outside of those cells, right outside of the gut lining, is our immune system, right? These pockets of lymphoid tissue, the GALT. So our microbiome and our immune system are constantly talking. And if that delicate barrier is compromised, and how do we compromise that delicate barrier? By creating that dysbiosis, by creating that imbalance in the gut microbiome, then we have this unhealthy cascade of inflammation that can actually, travel throughout the bloodstream and impact our entire bodies, including our skin. So when the gut lining is not healthy and intact, it can actually show up in our skin, our hair, our nails, like that. It can absolutely have systemic repercussions. So and what can affect dysbiosis? What can cause that gut lining to lose its integrity? Well, nutrition and diet can absolutely play a role in that, but so can stress. So if we're not sleeping properly, whether it's the quality or the quantity of our sleep, if we're experiencing a lot of stress, if we go through a stressful period in our lives, a divorce, a stressful exam, anything, especially ongoing, if it's more than just 1 or 2 days, if it's more of a chronic source of stress, that can absolutely affect that lining of the gut. And then in turn, that can set you up for this sort of vicious cycle of system-wide inflammation that can manifest in the skin.
So I think that's a great introduction because I wanted to sort of talk about, like, there is active research. When I first graduated, and even just as few as 10 years ago, we weren't talking a lot about what we eat and how it affects our skin.
Right.
And it's crazy to think that. But so now we have studies. I reviewed the literature on the gut-skin axis, and the first one that popped up there was an article in 2024, JAMA. So JAMA is the Journal of American Medical Association. So these are big journals. We're not talking like little journals that don't have a good impact score. It was looking at the effects of probiotic on atopic dermatitis. It was a meta-analysis. So meta-analysis is you look at a bunch of little studies and you sort of corral all their information to get is there a trend here? And what was interesting is, first of all, that they're even looking at it to that extent, and there was a positive correlation. My question here is, we had Dr. Calwart, who's a microbiome specialist from Belgium, on earlier in the season. And, probiotics, the thing is which probiotic, how much, how often, if you have skin disease. Now, diet is one thing, and I want to come back to the diet question, but, in this particular meta-analysis, it was acidophilus, which was the largest benefit with patients who had eczema. But in the end, it didn't really affect their quality of life. So my question is, probiotics and skin disease, or healthy probiotics and healthy gut, which ones do we use? Are we there yet? What are your sort of thoughts on that?
Yeah, I mean, I think it's hard. People say to me, what probiotic do I recommend? And, I think going with sort of the big hitters like Align,
Yeah.
Culturelle, they do have some solid science behind them. But I don't think that there's one quick supplement or one quick pill that's going to be a solution for everybody, and it's going to have these like huge effects on the skin. I really do think that it's more of a lifestyle commitment for people. So, first of all, it's what else are they eating in their diet? If you take a probiotic supplement every day, but you're eating a bunch of refined, processed, comfort foods devoid of fiber, that's going to feed unhealthy strains of microbes in your gut, and it's going to sort of completely undo the benefits of the probiotics. So, and I think having like a bunch of polyphenols in your diet, thinking about all the antioxidants, and, polyphenols are the brightly colored it's what gives fruits and vegetables their beautiful, vivid, bright colors, right? So like the pomegranates and blueberries and matcha tea. And when you think about like why nature has created these gorgeous, beautiful colors, they have an antioxidant benefit, but we now know the polyphenols also have prebiotic-like benefits. And they really do help restore that healthy balance of the gut microbiome. So, for me, it's all about talking to people about like what they're adding to their diets and making sure that they're eating the rainbow, making sure they're having healthy sources of fiber, healthy sources of fats, avocado, salmon, olive oil. You want to have your antioxidants, making sure you're not overdoing the refined processed foods. There are certain forms of dairy that can stimulate inflammation in the skin, really talking to people about all of those factors. And then, yes, if you want to add on a supplement, whether it's a probiotic supplement, I created the My Bogro elixirs made with polyphenols, which have the prebiotic benefits. That's considered a dietary supplement, but I never positioned it as like, you take this and don't worry about those other things,
Right.
and this is going to fix your skin. And I think that's just doing people a disservice. Like, I think that, and unfortunately, our medical system is not set up to incentivize dermatologists to proactively counsel and educate our patients. Like, we're reimbursed based on procedures. We're reimbursed based on prescribing things. Like, it's putting out fires. We can diagnose things, but dermatologists who take the time to really educate more preventatively and proactively, if they're actually being paid through insurance, at least in the United States, they're losing money on those patients. And so that it takes a rare, doctor who's going to prioritize that and incentivize that. Like, I'm in a unique place. My practice, I have a boutique practice. It's been capped. I have not taken insurance in forever. And I'm able to really have these in-depth conversations with my patients and practice medicine the way I want to practice medicine. But when you think about the way that our, system is set up, it's not really set up in a way to necessarily, really benefit the patients in more of a preventive way.
Right. Well, I think, like Sandy said, maybe probably at the beginning, part of the reason we did this is to to educate people.
Yeah.
And maybe, it could be giving a listener questions that she can go to her doctor with.
Right.
To get some real answers. If you know what you're asking, because if it's too general, it's so hard. But
the common one we get is, I have acne. Is my diet affecting it? And it's like, you got 2 seconds to answer the question. So in my office, I always say, we live in an age of inflammation. We have inflammatory gut disease, inflammatory bowel disease, arthritis are all inflammation. Acne is inflammation, eczema is inflammation. You can look at anti-inflammatory foods, and as a general, like that's kind of what you just said, a lot of that stuff, but at least they can then go and read. And I always say, don't read blogs, read something that has, we had another physician talk, it says .org or or edu, because then you're going to get the proper information. But
that was great advice.
I wrote an article called Diet and Acne, and it was incredibly controversial. I went against, when we were in training, we were taught the diet has no effect on the skin, right? I was taught by Albert Kligman, the diet had no effect on the skin. I was at Penn, and I went against my giants, my gurus that were mentoring me. Right. And I remember I went to my chairman and I said, I'm not seeing this personally. I'm not seeing this with my patients. I see that there is a link between our nutrition and what we're eating. And at the time, my chairman, Dr. Shalita, he's like, Whitney, if you're going to do this, if you're going to go against the giants in our field, you have to do it right, And so we actually published that very, very controversial paper. It was called Diet and Acne, and it was in the JAD. And I remember that was in 2010, I believe, is when that was published.
That was when it first, people were starting to really
just starting. And when I first believe me, people were very skeptical at the beginning, and then. Now I was awarded the presidential citation from the American Academy of Dermatology for my contribution in this field, because now everything has been revised, right? But I was one of the very first voices to talk about how actually our diet can affect our skin. So, but exactly what you're saying, most derms are seeing somewhere between 8 and 12 patients an hour. I mean, that's mind blowing. How much information can you deliver during that time? So, I think it's so wonderful to have resources like this podcast, saying to people okay, you can Dr. Sandy Skotnicki and Marlo, they have a podcast where they will take that deeper dive. I think they have an episode on this. Go check it out. Or, Dr. Bowe is on TikTok or, Instagram. There are experts out there that are creating content where even though we don't have the time to dive into it in the office per se, at least we can direct people, to look for somebody who's got that expertise behind them, who's trying to share that content.
Yeah. That's amazing advice. Thank you so much for speaking with us. There's so much incredible information. And just to listeners, I hope you enjoy this episode. Please don't forget to subscribe.
Wait,
do we want to say a couple more things? Sorry.
I want to say one more thing.
Go ahead.
2 things. I wanted to see if you had any final thoughts.
Oh, yes. Okay,
on science-backed skincare, and also tell us with the listeners, because I know you well, Marlo knows you well, but where the listeners can find your social media handle, your Instagram, TikTok, all of that.
So my final thoughts are very selfish. When you guys are ever in town, you have to let me know. We have to get together in person.
For sure.
Yes.
And you guys can find me so my website is drwhitneybowbeauty.com. And on social media, I'm at Dr. Whitney Bowe on Instagram, TikTok, and YouTube.
Great. Thank you so much. So thank you again.
Can we get, the lip balm's going to be in stock soon?
Yeah. I think Ryan, our producer, wants one too. He's nodding his head. Yeah.
We've got 3 in the mail for you guys.
So I hope you enjoyed this episode. Please subscribe and leave a review. It helps us. And we can't wait to see you next time on Skin to It. Thank you so much, Dr. Whitney Bowe, for joining us.
Thank you. Please let us know what you thought of today's episode.
If you have any questions or thoughts, send me a message on social at Dr. Sandy Skotnicki. And don't forget, all the links and resources we mentioned are in the show notes.
And if you haven't already, please subscribe and leave us a review. It helps us to bring you the content you love.
Until next time, take care, and we'll see you next week on Skin to It.